Okay, so thank you very much for the invitation to this event organized by the Portuguese presidency. I will speak today about the European health data space. As you know, the Commission is working together with the member states in this area on several directions on a legal proposal to be put forward by the end of this year or the beginning of 2022 on data quality to ensure that the data is findable, accessible, interoperable, and reusable, on infrastructures, both for the primary use of health data and the secondary use of health data. Um, and I will come back to this a little bit later, and also on the capacity building, supporting the digitalization of health and of health sector, but also for basically sharing of best practices, training, etc. When it comes to the legislative proposal, the main problems that the health sector is confronted with and we are trying to address are related to the limited control of patients over their health data and interoperability between healthcare providers and sharing of this data between different healthcare providers. So the areas of work will concentrate on strengthening the control of patients over their health data, interoperability, role of the e-health agencies, etc. On the single market for digital health services and products, the issues are related to an uneven legislative framework and quality framework for the member states, uneven procedures for prescriptions, reimbursement, and liability, and the areas of work concentrate on eliminating the barriers to the free movement of these services and the provision, their provision cross-border, and supporting the patients to have their data integrated into their electronic health records. When it comes to the access to health data for research policy making and regulatory purposes, we have recently done a study in this area, and we have realized that there is a wide fragmentation across member states. In terms of legal basis for accessing the data, but also in terms of infrastructures, the governance, and so therefore the areas of work will concentrate on the governance and rules and making data findable, accessible, interoperable, and reusable, and a digital infrastructure on supporting the reuse of health data. And last but not least, also linked to this use of data for research policy making and regulatory purposes, the support for the development of the artificial intelligence. So we are not building from the scratch. We are the European Health Data Space will be built upon the GDPR, upon the Data Governance Act, and also upon the recently adopted framework for artificial intelligence. That will be taken forward and clarified for the area of health. In terms of the use of data for healthcare, the primary use of data, or EHDS1, as we like to call it, as I explained before, the main purpose would be to support the rights of patients to access and control over their health data, to access in an electronic format, different categories of data, patient summary, prescriptions, but also images, lab results, discharge letters, to ensure the interoperability and sharing the data between healthcare providers, and to strengthen the current infrastructure supporting this sharing of cross-border exchanging of patient summary, prescriptions, and later on images, lab results, and discharge letters, namely My Health at EU. Also, on the digital single market for telehealth and health, we are aiming at supporting the provision of the services cross-border and taking further the directive 2011-24, the Patient Right Directive, supporting the development of quality criteria and basically the evaluation of devices and of services, taking into account also what exists already in the context of the medical devices regulation. And for this, of course, we need a governance framework, both at national and also at European level. Now, when it comes to interoperability, a lot has been done already at EU level with the electronic health record exchange format that is supposed to, to evolve and to be developed. And with the legal proposal, this is what we are aiming for, namely to take this forward and to strengthen the interoperability, supporting the people to take their data with them or to share their data with healthcare providers of their choice when they travel abroad or when they move to another country. Now, what is being done already? As I explained, we have an infrastructure for the primary use of health data, which allows for patient to share patient summary and e-prescriptions when they are traveling abroad with the healthcare professionals of their choice in the language of the healthcare professional. I think this is a very important element, the language of the healthcare professional. How is this being done? Through some national contact points. This is a little bit of a technical picture. So basically these national contact points, they have the possibility, the capacity to integrate, to aggregate the data of the patient, be it medication, vaccination, allergies, etc., in the patient summary, and to share it with the healthcare professional of Portugal, let's say, or let's say a Croatian patient that goes to Portugal, to have the data being accessed by a Portuguese a doctor in Portuguese, and that doctor can see whether the patient is allergic, whether he or she has taken some medicine that could interact with the medicines that the professional would like to give him or her, etc., etc. So this is very, very important for supporting the treatment. We are also aiming in a second level to support the addition of more information, images, lab results, and discharge letters, because one of the main sources of repetition of costs in the health sector is also the repetition of unnecessary costs, be it laboratory results, be it images, etc. So transferring the data between healthcare professionals can contribute significantly to reducing these costs. So I don't want to insist on this. I was explaining the patient summaries and also the prescriptions. We have already around 15,000 e-prescriptions exchange, especially between neighbors, between Estonia and Finland. And what we have noticed is that more neighbors we have, more these exchanges are increasing. On the digital health services, what we are looking at in the context of European health data space are aspects related to the reimbursement, taking further basically what is being done under the Patient Rights Directive, interoperability, labeling, certification, but also data privacy and liability. And we have a lot of examples in different member states, like for instance Belgium, Germany, etc., where the different bodies, medicine agencies or HTA bodies, they look at the medical devices and they add additional elements that could support the analysis of these devices and the prescription of prescription and reimbursement of these devices or apps for care purposes. There is also an element related to transparency, to quality labels, and this is an important aspect that we are looking into, especially in order to ensure transparency for the users. On the secondary use of health data, so the use of data for research and policy making, which is the second main area of work, the legislative proposal will look into the rules and conditions for access, also the sources of data, be it public or private, how the data are being exchanged, the interoperability, the data quality, including for artificial intelligence, and also the governance at national and European level and the infrastructure. As I said before, we are not building from the scratch. We are basing ourselves on the Data Governance Act, and we are aiming to set up a lex specialis for the health sector. As you know, the GDPR as well allows for several grounds for processing sensitive data like health data, including national or European legislation. So European health data space aims to be also a lex specialis supporting the implementation of the GDPR and also of the Data Governance Act. And from this perspective, we are also looking how the EHDS could support data altruists, could support the governance mechanisms for the secondary use of health data that have been already set up through a Data Governance Act or are being proposed actually by the Commission. Um, Also the collaboration at European level with the European Data Innovation Board. In the area of AI, the recently adopted AI regulation supports the standards for the safety of AI, and we are also looking how governance body at national level can contribute to this work, and how basically that they can also support the work of regulatory authorities like medical devices, medicine agencies in their work of evaluating AI algorithms or devices with the software and AI algorithms. Um, in this context, I was speaking at the beginning about an infrastructure on the cross-border access and for of health data and for the use of health data that we are aiming to have it operational by 2025 with a pilot project to be launched in 2021. With the we are also using here the same context the same concept we are having for basically the primary use of data of nodes of trust anchors between different member states, where we are supporting the link between national governance mechanisms, which are ensuring the link between the data holders and data users. And you probably know that such bodies are, for instance, FinData, French Data Hub, German Research Data Center, etc. SPMS is also supporting access to data for the researchers. We are also trying to bring together research infrastructures with some primary use cases related to EMA, to public health, to EMA and ECDC. And this pilot project is aiming basically to support, to test how such an infrastructure could work and to basically look into the governance, into the possible data infrastructures, how such an infrastructure could work cross country, etc., etc. Now, when it comes to the next step, we have published the section impact assessment. It was quite successful. We have around 150 contributions. Also, we have launched the public consultation, and we are inviting you to contribute to these public consultations, which will last until July. We are also working on the impact assessment with the view of having the legislative proposal by the end of 2021 or at the latest in Q2 2022. When it comes to the funding, there are several sources of funding, national funds, European Regional Development Fund, Recovery and Resilience Facility, InvestEU, ESF+. We are also looking at the possibility of strengthening the conditionality for interoperability, also based on basically the work that has been put forward by the eHealth network in its investment guidelines. And at European level, we are also trying to support these digital infrastructures through EU for Health, through Digital Europe program, and through Horizon Europe. We hope that together, all this funding will support a successful European health data space. So I would like to thank you very much for your time and for the opportunity to provide this presentation and for the invitation to this event. Thank you.